Hi, I'm Emma Fields and I'm a radiation oncologist.
I'm Laura Padilla and I'm a medical physicist, and we're both at Virginia Commonwealth University. Today we're going to talk to you about our patient communication training for medical physics graduate students. The reason why we decided to design a training for patient communication is because medical physics as a field is evolving. Medical physicists are becoming more patient facing, and it's really important that they get trained on how to properly and effectively communicate with patients. To this end, UCSD has already created a training, but it is geared towards practicing medical physicists and medical physics residents. Medical students go through a curriculum on patient communication from their first year in medical school, and we thought that it was really important that we instituted something similar for medical physicists. And this is why we started working on developing a patient communication training for medical physics graduate students. To make the training the best it can be, we decided to ask the social workers in our department to see if they want to collaborate with us, since they have very high expertise on patient communication.
The workshop consists of 3 sections. The first section is a prep section for our students, as they have little background knowledge on patient interaction. The first part of the prep is watching patient testimonial videos. These are videos recorded by a woman who was treated with radiotherapy for breast cancer and documented her journey. Following that, they write a reflective piece about what surprised them with her process. The second portion of the prep is a lecture on the overview of the radiation oncology process, particularly focused on what happens at the time of simulation, as this is what their standardized patient will discuss with them. After that, the students have their first standardized patient encounter. The first standardized patient is a relatively straightforward patient who's going to ask them some simple questions about CT simulation. Following that, our social work colleagues will give a lecture on the basics of effective patient communication strategies. The final portion will be the second standardized patient, where their competence will be assessed with a slightly more challenging patient. Following that, they'll be asked to write another reflective piece on their experience with the workshop. To measure the effectiveness of the training, we will use pre- and post-training surveys that ask the participants to rate their comfort level on several different aspects related to patient communication. We will also compare their competence from baseline to their second standardized patient encounter. We had planned to deliver this workshop in our simulation center on March 21st and 28th.
But then coronavirus happened, so we had to adjust. Thankfully, the simulation center is running simulations virtually now, so we get to do both of the standardized patient encounters online as well as our lecture. This is a work in progress, obviously, but we are very hopeful that we will have a full set of data to analyze by the end of the month. We would like to thank all of the authors, not just the social workers, but also Dana and Lori, who are helping us with the simulation piece. Thanks for watching.
Thank you.